Hello and welcome on Tafaragadamu. My guest today, Dr. Tewodros Haile, is a pulmonary and critical care specialist. He also heads the internal medicine department at the Addis Ababa University's School of Health Sciences. Well, as you might have guessed, he's joining me to talk about the COVID pandemic in Ethiopia in light of the recent trends. A very warm welcome to the program.
You're welcome. Thanks.
Yeah. The number of COVID patients in Ethiopia is on the constant rise. Is that a bit too concerning, you think?
Sure. Yes, since the last January, we are seeing just an increase and a rise in the number of patients who are, becoming COVID positive, and also the number of patients who are being admitted to the hospitals, and in particular to the ICU, that's the intensive care unit. It's alarmingly increasing, and the number of days are also, increasing, and we are having these days more than 30 days per day due to COVID. So it's a really concerning issue.
So before January, the death the statistics was a little bit too low, right?
Yeah, sure. Since we had the first case in March 2020, steadily it has been increasing, but just after a few months, like in May, it started to peak, and we had the first peak in mainly in July and August, and it came down for some time, and then now it is peaking again as of January.
Interesting. Last week on this show, I had hosted a guest talking specifically about the same issue. I want to have an insight into the issue here on this program too. I mean, have we reached, do you think, a point where it is too devastating as far as the healthcare system is concerned?
Yeah, the first thing, the most important thing that we should do is, the preventive work, the public health preventive activities that we should have focused. And I think it's because initially the Federal Ministry of Health and the government has reacted very well, in introducing these measures of prevention, like, keeping distance, avoiding handshake, and also wearing face masks and hand hygiene. That has, somehow protracted, or, at least, delayed this pandemic from, infecting several people at a time and being overburdening our health systems. But, as the time goes, people started to relax, and there is what's called fatigue. When people are told to strictly to not to do this, and the like, people get fatigued, and with that we start to have an increase in the number of the patient, and now our health system is getting burdened. As of January, the number of ICU beds we have is limited. And generally, it's not more than 650 or something, and the number of ventilators we have for the whole nation is not more than 450. So, with this increase as of recent, like having more than 900 severely or critically ill patients, will definitely overburden our health system. It's not only the bed occupancy, but also the drugs, the machines that this patient requires, and also the healthcare workers that caring for this group of patients required will be increasing, and so we have to shift the healthcare workers from other type of services to the COVID one, and definitely will also compromise the non-COVID services. So we are having this burden to our health system.
So you also mean specifically in this case that there are a lot more patients out there than the hospitals could accommodate as far as the ICU units are concerned?
Yeah, sure. Yeah, there were times that ICU beds are in short, and even also, COVID centers. There are some so-called COVID dedicated centers or hospitals, and there were times that those beds were even in short. There was a mismatch of the number of patients we have and the number of beds we have. So definitely there is definitely a mismatch. We are having just increased number of patients compared to the beds we have.
So how are you handling the cases that's outside of the hospitals that basically cater for these patients? How are you handling that?
As the number of patients increased since last year, after July, August, we have introduced this what's called home care. For those who are mildly ill, just can be kept at their home, and they have to isolate themselves from infecting their family members, and they can be cared there until they see some bad signs. We teach them when we advise home care. We advise them that what are which of the symptoms are indicators of bad symptoms or indicator of severity. Then once they have that, they will report back to the hospital. But majority, as COVID, among 100 patients who are sick of COVID, 80 of them are said to have mild disease or asymptomatic at all. So this majority will be at home. So, if we test a lot of people, definitely will have a lot of cases, but those cases, should be managed at home. Those with moderate to severe and then critical should be kept at hospital, and they may need oxygen, which is now we are in short supply also, particularly in Addis Ababa. We are having a shortage of oxygen. Due to one of the plants, the oxygen plant is not functional these days, so we have to bring from the regions. Now we are in short of such supplies, critical supply. Oxygen is one of the critical things that patients with COVID should receive.
So, but there are people who need some critical care who should have been in the hospital, but are not admitted as yet. There are quite a sizable number out there who need those kinds of services.
Yeah,
I'm talking about people who are outside of the ones who are being taken care of at home.
Yeah, definitely. As much as 5% of patients who have got COVID, they are said to become critical. So, as the number of patients increases, definitely a proportion, 5% definitely will have a critical illness, and they will require critical admission to the ICU. So when the ICUs are full, they will be kept in the wards. But in the wards are not as good as the ICUs, the critical care, to get the required treatment. So they have to wait. They have to have a queue in the general ward, to be admitted to the ICU and to receive, high flow oxygen or non-invasive mechanical ventilation or invasive ventilation, the machines. So definitely we have some patients that who needs critical care service but are not getting.
Even the ones that are being treated in the wards could be sources of new infections.
Yeah, actually we are having that, for example, the hospital I'm working, Tukurambasa Specialized Hospital, we have isolation center, but that's not enough for those patients to be kept. Those who become infected, they have to be isolated. But the beds that we reserve for isolation is not enough. That we have to keep them in the ward, and they are infecting other patients, and also the healthcare workers also are getting infected. So that's the problem we are now facing, actually.
So what is, you say that this is quite a burden to the healthcare system in Ethiopia, not necessarily in Addis Ababa, but all over the country. So how is the healthcare system coping with this outside of Addis Ababa, you think? Because the problem may not be as serious in the metropolis in Addis Ababa, but it is serious nonetheless.
Yeah. Just the good thing is that, COVID usually it focuses on, on people who are, residing, in a small space, a large number of population, like cities, Addis Ababa, where you have slums and something like that. But outside of Addis, because our people, live sparsely in the regions, it doesn't much affected our regions. But exception to this is probably Hawassa, where there is a lot of cases being reported, and now there, even though it's not as serious as the case in Addis, but they have started to suffer. There is a higher rate of infection, and so as the number of infection increases, the number of people who needs critical care and admission increases. So they are a little bit suffering, but the rest of the rest of the country, it didn't much suffer, because of the way our people live, outside of the cities, the major cities. But outside Addis, it's Hawassa probably is suffering a little bit.
So how are they coping with this in Hawassa? Are the figures coming in?
I don't have much information specifically. I didn't ask as of recently, but from the information I got from colleagues, that they are having increased number of patients. So, and also some of the patients will be kept in the government and the public service, public hospitals and the like. But some are also being managed in the private, because the private sector is also developing there in Hawassa, and also people also are seeking treatment also in the private sector also.
So interesting. So the government has introduced, a Ministry of Health has introduced a new regulation, right, so to kind of build on the preventive measures that have been placed in the years past. Is that effective?
I don't think so. The type of regulations that have been in place back in March 2020, after we saw the first case, that has been really great. That has been implemented, and some types of surveys that has been conducted during that time. In May, around May, April, May. The degree of compliance from the public was, for example, for face mask wearing was like more than 70%, for hand washing was like more than 50%, for keeping distance was like at least 50%, 40 to 50%. But now, if you see, it's very, very low. You can see people in the city not wearing face mask and the like. So probably, the reason for this second wave that started as of January was that because we didn't fully comply with what the Federal Minister of Health regulations has been put in place. I know that the government has tried to strengthen on those, but people are not still not complying. Still people are gathered in masses. They are having meetings, more than 50 people at a time, and the like. So, and unless we comply to that, I think that the disease will continue, and it's still on a rise. There is not any sign of coming down, these days. We would expect, if and it depends, whether we comply to the public health measures or not. If you comply, it will come down. If not, it will continue to rise. So there is no much, compliance to what the government regulations has put.
It's interesting. With compliance out of the question, then what choices are we left with now?
Yeah, we'll be burdened. We'll have a lot of infections. We are losing people. Experienced people, because the disease, mortality is more in the elderly, older people. So we are losing the wise people in our country. So I think the community has to comply to that. Particularly the youth, the youngsters. I know that the majority of the young people may not have severe disease, but they have the obligations and the responsibility to protect their fathers and their grandpa and grandma. So people, particularly the youth, has to comply with the regulations the Federal Minister of Health and the government has put in place. Otherwise, we don't have any options, because our medical services are not strong enough to handle or to shoulder such burden, and we may lose a lot of people if we remain not complying with the regulations.
Is lockdown a measured one at that an option, you think?
It depends. Lockdown, just locking down the whole country, maybe also have some economical consequences, but partial lockdown, as it has been tried last time, and it can be limited only to major cities where this disease is becoming a serious problem, or part of the city. So I think it may be good, at least first to try with closing schools or some events that a lot of people will be gathering, and if it's not working, such lockdown can work. There was a good example from South Africa, where they have this is one of the strictest lockdown in the globe. They did it last year in March 2020, or around there. So they have brought down the infection rate from 42% to 4% with this strict lockdown. So it is definitely, it works, particularly, and we have now this vaccination. If you are vaccinating people, a lot of people, particularly the elderly and those with comorbidity, then we can decrease at least the number of diseases. If not preventing the infection, but we can decrease the mortality.
It's interesting that you raised the South African experience. You are a member of the Africa-wide coronavirus and preparedness team that has been established, I guess, by the Africa CDC, correct?
Yeah, sure. Sure.
Do we have some great experiences from other African countries that we perhaps could, not necessarily mechanically, but somehow transplant into the Ethiopian case?
Actually, it's Africa CDC that has been giving a direction. There was a very swift response from the continental level, where all African states are member, and there was a good direction. All countries were working together, so there was a swift response from the continental level. And it is Africa CDC that was giving the direction, and also especially helping those countries, like 10 to 15 countries where they were lagging. There were some 10 countries where they didn't even have a ventilator. They didn't have a well-trained people, to manage critically sick people. So in that terms, we're at better level. And once the disease starts to progress, our country also did very well, particularly with these public health measures. The problem is that we don't have enough critical care services. And there are countries like South Africa, Egypt, and to some extent Cameroon, where they have a better critical care services, where they have better ICU beds, better machines, better number of machines, and the like. Otherwise, with regard to public health measures, Ethiopia has done very well. It's one of the good the countries that has, adopted their own case management, which has been, prepared by WHO, but adopted to our own country. So it's one of the countries that has done very well, is our country too.
It did, you're right, in the prevention side, but we were so much focused on that side that we gave very little attention to cure. So basically we were caught unawares as far as this pandemic is concerned, right?
Yeah, definitely. And, that has been actually the focus for the whole continent, as me as a member of the African Task Force on Coronavirus, particularly on the case management. Because African countries have an integrated, well-established preventive work, public health workers, that has been put in place the last 20 years. Particularly, it has been strengthened since Ebola came into picture in 2016. Since then, it is very strengthened. So we have to maximize our effort, where we are very strong, and a lot of good work has been done, because we don't have a very strong medical service, critical care service. And critical service is not something that you can produce it overnight. It needs some time. You have to train people. We have taken a lesson, and enough lessons, that this is an opportunity. We'll take this as an opportunity to strengthen our critical care in the future for the whole country and for the whole continent. And we can say that we are building on that. But we may be a little bit short in oxygen. Having expanding oxygen plants. That is the direction we discussed actually. I don't know what happened in between. So I was, a little bit disappointed seeing that there is a shortage of oxygen, after 1 year of, discussing and giving direction on this regard. So that's a little disappointment I have. But, we are expanding our critical care. We had, one critical care service only in Black Lion, like 6 or 7 years ago. But now we have 53. We are expanding to the whole country, to the whole region. But the quality of this critical care service it's at its infancy level. It's not well developed. So we are working on that. We are preparing, trainings and also drug lists, equipment lists, and we are distributing that. We are working on that regard also, with closely with the Federal Ministry of Health, Emergency and Critical Care Directorate department. We are working in that line also.
Interesting. On the vaccine front, it's commendable. I mean, it's quite encouraging that people are getting those shots, but not nearly enough.
Yeah, it's we are way behind. People are, due to this misinformation about the vaccines, people are not getting the shots as we expected. It's
is it because of this? Is it because of this misinformation, as you just said, or something that's got to do with the supply side?
Definitely, we'll have. We also have a shortage on supply side because we have only some limited doses now. But even those among those doses which are available, people didn't get the required number. So we are hearing that people are afraid to get the shots, but we are working also in that line, to create awareness among the public that they have to get, particularly the elderly, and also who has got additional comorbidities, that is chronic illnesses, non-communicable diseases that can expose them to bad outcomes. So even from the dose that has arrived to Ethiopia, it's not yet, we didn't yet reach to the risky people, to the people who are at risk. Even there are some health professionals are even refrained from getting vaccinated. So
have you?
I have received that, definitely. I have received that. Yeah, sure.
Interesting. So I guess on that, we need to end this conversation. Thank you very much indeed for your expertise, Dr. Tewodros. It was really a pleasure having you on my show. Thank you very much.
You're welcome. Welcome, Professor. Thank you.